In this video, we're going to be going over cystic fibrosis, which is a hereditary disorder characterized by lung congestion and infection and the malabsorption of nutrients by the pancreas. So when you look at normal lung function, we talked about the cilia and how the cilia move that mucus along its surface, and any type of debris or particles that get caught in this mucus layer move out by the cilia. The cilia is moving this mucus layer. The consistency of the mucus is such that it has a certain thickness that the cilia can still move that mucus over the top of it. Well, when you look at somebody with cystic fibrosis, what we're going to see is that mucus is really thick, and the cilia can't move the mucus because it's so thick. That's going to result in a plugging up of airways, as you see here, compared to the normal opened airway, because the cilia just can't move that thickened mucus. So cystic fibrosis is characterized by the production of a thick mucus that results in lung congestion and decreased absorption of nutrients. We're also going to see that it has a big effect on the pancreas, those ducts in the pancreas to get those digestive enzymes from the pancreas into the small intestine. The cause of cystic fibrosis is a defect in what's called the CFTR gene that codes for a membrane protein called the cystic fibrosis transmembrane conductance regulator. This is where we get that CFTR. And this is a normal gene that functions in the movement of chloride ions by these chloride channels, shown here in this membrane. Here's our phospholipid bilayer. We have these chloride channels, and these chloride channels pump chloride. And we're going to see that in different parts of the body, they'll either pump chloride from outside the cell to inside the cell, or inside the cell to outside the cell. Depends on the specific type of CFTR transporter. If you have a defect in this channel, this causes an abnormal sodium chloride and water movement through the cell membrane, which will result in the formation of a thick, sticky mucus, secretion that plugs up ducts and passageways, and very salty sweat. We've been talking a lot about different genes, the proteins they produce, and then soon we're going to be going over how you actually go from a gene to a protein. It's important to realize that there's a defective gene for this particular channel, and this gene codes for this protein that you see right here. If you have a defective gene, you're going to have a defective channel, and that's going to cause, in this case, it's going to cause cystic fibrosis. And this gene, this CFTR gene, is found on chromosome number 7. So let's take a look at why somebody with cystic fibrosis would have an increase in salt in their sweat. Shown here is the skin, and this is a secretory gland. It's a sweat gland, and it has the duct that comes up and empties the sweat onto the skin. Well, when you look at sweat glands, at the very base down here, where the sweat's produced, if you look at the salt concentration of that sweat, it's going to be 140 millimolar of sodium chloride. And that happens both in the normal sweat glands and in the sweat glands of somebody who has cystic fibrosis. You have that amount, 140 millimolar of sodium chloride. Well, then this sweat moves up. In a normal person, it'll move up through this duct. So this part right here is represented by this duct. Notice at the very end, when that sweat comes out, it only has a sodium chloride concentration of around 20 millimolar, which means that the chloride gets reabsorbed, and the sodium follows that chloride because chloride has a negative charge, sodium has a positive charge, so it's attracted to this negative charge chloride as it's moving out by those CFTR channels. And so the body reabsorbs a lot of that sodium chloride, and it needs to do that because you need sodium chloride within the body. So this is a way to reabsorb that sodium chloride so you don't lose all that in your sweat. In somebody who has cystic fibrosis, that chloride channel is defective, and it's not moving the chloride from in the sweat here coming up through the duct back into the body, which means that that sodium chloride is going to be in higher concentration. Here, it's 100 millimolar when it comes out to the surface of the skin. So that's going to cause a really salty tasting sweat. Now you normally can taste salt in your sweat, but it's not as salty as it would have been had you not had your chloride channels working properly. The CFTR channel controls the movement of chloride ions through the plasma membrane, either from inside the cell to outside or outside the cell to inside, depending on the cell location. Now what we were just going over with these sweat glands, it was from outside the cells to inside the cells, because the sweat was in the ducts. But what we're going to see later on, we're talking about the lungs and we're talking about the pancreas, it's going to be the movement of sodium chloride from inside the cell to outside the cell. So it just depends on where that channel is and its specific function on whether it's moving chloride in or out of the cell. In the case of the sweat glands, it was moving it back into the cell along those ducts. When you're looking at the CFTR channels in the skin, sodium chloride is a normal component of sweat, but most of the sodium chloride is reabsorbed. The chloride channels in a cystic fibrosis person aren't working correctly, so chloride remains in the ducts. The negative charge on chloride attracts a positive charged sodium ions and keeps the sodium from being reabsorbed. This is going to result in a large amount of sodium chloride lost in sweat. This is the physiological basis of why somebody who has cystic fibrosis is going to have more sodium chloride in their sweat. And you can use this as a diagnostic tool. We call it the sweat test. Basically what happens is that in the sweat test, you analyze the amount of sodium chloride in the sweat of a person, and that can be used to diagnose cystic fibrosis, along with all the other symptoms that can happen with airway and digestive problems. But what about CFTR channels in the lungs and the pancreas? Here we're going to see is that these CFTR channels actually pump chloride ions from inside the cell through the plasma membrane to the surface of the cell. These cells are lining the ducts, either in the airways, and they're lining the ducts in the pancreas. Well, what's the purpose of this? Well, you have cells that are going to produce mucus. These are mucus-producing cells. And then this mucus gets produced, but it's pretty thick. What happens is that these cells, through their CFTR channel, pump chloride out, and we're going to see that by osmosis, water is going to follow that chloride ion, as well as sodium is going to follow it. And then that's going to cause water to move by osmosis through the membrane, and it's going to loosen up this mucus. That's normally what happens. And then the cilia can move this watery mucus along, and it functions normally. But what happens if you have cystic fibrosis, and these chloride channels aren't working correctly? Well, the mucus still gets produced, but it's really thick. And it can't be loosened up or can't be watered down because the chloride channels aren't pumping the chloride across, so water doesn't follow that salt by osmosis. That results in a real thick mucus buildup here, and then the cilia can't move it along. So CFTR channels in the lungs and the pancreas, this results in a thick mucus that clogs the passageways. Mechanisms of the thickened excess mucus production, still uncertain, although what I just described is a lot of what we know. But there's still a lot that we don't know about this. This thick mucus isn't easily moved by the cilia, and what it does is it sets up a breeding ground for bacteria, resulting in frequent lung infections. The reduced oxygen in the blood also leads to a characteristic rounding and enlargement of the nail bed, you can see here, in the fingers and toes, and we call this clubbing. This is one of the characteristics of CF, so you want to make sure you star that. Well, the clogged ducts in the pancreas, shown here, limits enzyme release, resulting in poor nutrient digestion and absorption. The pancreas is very important in producing the hormones insulin and glucagon that function in blood sugar regulation. And in addition to that, the pancreas produces large amounts of enzymes for the digestion of food. When the stomach empties its contents into the small intestine, digestive enzymes from the pancreas are produced, they move through the ducts, and they help to digest those food particles in a small enough unit so they can be absorbed into the bloodstream. When you plug up these ducts, the enzymes that the pancreas produces can't get into the small intestine. Therefore, the person who has CF also has poor absorption of food, because they're not able to digest their food properly. The occurrence is about 1 in 2,500 births. It's the most common fatal inherited disease among Caucasians in the US, and it's considered to be an autosomal recessive pattern of inheritance. This just gives a brief overview on how you can get autosomal recessive patterns of inheritance. Every person inherits 2 CFTR genes, which is your cystic fibrosis transmembrane conductance regulator. That's that protein. And these genes are going to code for that protein that gets put in the membrane. You get one of these genes from each parent. So for example, let's say you have a mom and dad and both are carriers. They don't have cystic fibrosis, but they're a carrier for that defective gene. They mate, they have children. If you have 2 heterozygotes, like shown here with mom and dad, you have a 25% chance of having a child with cystic fibrosis, which has those 2 defective genes, and a 50% chance of having a child that's a carrier, and a 25% chance of having a child that is normal. Now, the carriers don't have cystic fibrosis, and the person that's normal obviously doesn't have it. It's only if they get 2 of these defective genes. And we'll talk a lot more about this when we go over patterns of inheritance in lab. There's no cure for cystic fibrosis, and most patients die before the age of 35. And at least one Caucasian person in 25 carries a mutation for their CFTR gene. Symptoms include coughing, wheezing, respiratory illness such as pneumonia, bronchitis. They suffer weight loss because of the poor absorption, salty tasting skin, greasy stools. The secretions block pancreatic enzymes that help digest fats and proteins. The symptoms and severity of CF vary widely. Some people have serious problems from birth. Others have milder versions of the disease that doesn't show up until they're in their teens or young adults. The treatments, the goal is to prevent infections, reduce the amount and thickness of secretions in the lungs, improve airflow, and maintain adequate caloric intake and nutrition. So they use antibiotics, they use mucus thinning drugs, use bronchodilators, bronchial airway drainage. They use oral enzymes and better nutrition, and if it gets really bad, then they can have a lung transplant. Here's a video of an individual who has cystic fibrosis that'll give you a better understanding of what it's like to live with cystic fibrosis.
Hi, I'm Missy Ayers. I'm 29 years old. I live in Minneapolis, Minnesota, and I was diagnosed with cystic fibrosis when I was 2 months old. Cystic fibrosis is a disease that affects my lungs as well as my pancreas. It causes my lungs to have a thick, sticky mucus buildup, and also your pancreas is blocked with this mucus. So when I was younger, I had to have my back pounded on every day for my treatment, and I would do that for an hour or so. Then I was given a vest machine, which is what we call this, the vest. Every day I do a treatment for a half hour, twice a day, to shake the mucus out of my lungs. I also do a nebulizer that pumps medicine in me to thin the mucus so it's easier and more lucid throughout the body. And I take enzymes every day with all my meals to make sure that my food gets digested. Growing up, I was always encouraged to participate in lots of different sports, whether it was running, dancing, skiing, anything that would just get my lungs out and active and give them a workout was encouraged. As an adult, I am also active in running as well as skiing, and I've even started coaching for our old high school team. 4 times a year I have to go to the University of Minnesota to have different tests performed. One of which is called the pulmonary function test, where I fill my lungs with air and blow into a tube as hard as I can until they're empty. And it measures different capacity levels that my lungs can hold. If my numbers are even par with what I've had in the past or higher, that's great, and I'm doing well and very healthy. But if my numbers fall below where I've been in the past, oftentimes they'll want to admit me into the hospital to boost my lung function scores. When I was younger, about 8 or 9, I became a poster child for the Cystic Fibrosis Foundation here in Minneapolis with several other kids my age. And we would do public appearances and just raise awareness for CF. So I've always been really involved with the foundation. So the Cystic Fibrosis Foundation puts over 90% of their money into cystic fibrosis research. This allows for several different drugs to be tested, several different methods of treatments to be tested, in order to make life a lot easier for those of us with cystic fibrosis. The Great Strides event is a walk that the CF Foundation puts on nationwide, and they raise hundreds of thousands of dollars each year. Team Missy is part of the Great Strides event. When Team Missy started 5 years ago, we had no expectations on what we'd raise or how much support we'd have. Each year I'm awestruck at the amount of support that complete strangers or longtime friends give towards Team Missy. It's meant more to me every year than the last. When I was born in 1980, the life expectancy for a cystic fibrosis patient was 18. And now, in the year 2010, it's gone up to 37 years old. Many people ask if I'm, afraid of knowing a life expectancy is so near or, afraid to die. But you should just live your life to the fullest now while you can. I think it's made me maybe just want to explore and get out there and see as much as possible, because you never know what's going to happen. I've never let cystic fibrosis stop me from anything I want to do, whether it's participating in activities or getting married or the thought of having children. I want to be as normal as anyone else. Your donations help fund vital research to find a cure for cystic fibrosis. Become a member of Team Missy today.
All right, let's go ahead and test our knowledge. You want to select the term that makes the sentence correct. Pause the video. And here are the correct answers. Here's part 2. Go ahead and pause the video. And here are the correct answers. If you have any questions, please don't hesitate to ask.